Hello, my name is Maria Pazmiño. I go to talk about triple TFT molecular therapy of cystic fibrosis. Definition: cystic fibrosis is one of the most common life-threatening autosomal recessive disorders. It is caused by mutations that result in deficit or defective function of the cystic fibrosis transmembrane conductor regulator, an ion channel that is normally present in epithelial membrane.
CFTR modulators are drugs that help CFTR protein function normally so that it conducts chloride and makes mucus the proper thinness. Until recently, only about 60% of the CF population was eligible to take CFTR modulator therapy. With the approval of triple combination CFTR modulator therapy, we should be able to treat upwards of 90% of the CF population. Triple combination modulator therapy is made up of 3 separate drugs, each of which restores CFTR function in slightly different ways, but together complement each other's activity. In clinical trials of triple combination CFTR modulator therapy, we saw improvements in lung function, reduction in the risk of pulmonary exacerbation, and reduced symptoms in clinical trial participants. These improvements were seen in individuals with 1 or 2 copies of the most common CFTR mutation, F508del. It is important to have other CFTR modulator options available because we know that individuals with CF respond differently to these medications. Another modulator class that's on the horizon is called an amplifier. Amplifiers increase the amount of CFTR protein in the cell. With more CFTR protein in the cell, other modulators should be able to have a more powerful effect. Hopefully, we will see that there will be a range of CFTR modulator options for individuals with CF so that they can have a customized treatment regimen. There will be several trials in the coming year, the first of which is Simplify, a study of treatment simplification in individuals taking triple combination CFTR modulator therapy. We will assess the effect of withdrawing hypertonic saline or Dornase alpha on lung function. We are studying treatment simplification because we have observed that triple combination CFTR modulator therapy has led to health benefits that make us question the need for time-consuming and burdensome therapies. The goal of the
Pros and cons. Pros: who undergo treatment has a better quality of life, living more than 40 years, something that was impossible before. Cons: it is likely that as there are having results of this and other new molecules, it is necessary a molecular or combination of these according to the mutation or anxiety in each body.
Malabsorption secondary to what they thought at the time was something called celiac syndrome. Among these cases, she also described neonatal intestinal obstruction or meconium ileus, intestinal and other respiratory complications, including some bronchiectasis, and many other features that we now recognize to be part of this syndrome of CF, including vitamin A deficiency. In the 1940s, the median life expectancy in CF was only about 18 months. It was also during the 1940s, 1950s, kind of a vicious cycle of disease and of infection leading to more inflammation, leading into more obstruction, but then goes back into infection. Just repeating the cycle, leading to worsening lung function, more progressive decline. So as I mentioned before, we have done a lot of work over the past several decades to attack and come up with treatment modalities to attack each area of this vicious cycle. Just to not leave a big question mark, ASL stands for airway surface liquid. So again, the take-home point from this slide is that I'm not going to get into the details of many of these things, but we have a truly comprehensive and complex treatment regimen in place to approach each of these different targets. Now, I just want to take a minute.
Application in nursing. The goal of their treatment include prevention and controlling infections that occur in the lungs, removing and loosening mucus from the lungs, treating and preventing intestinal blockers, providing adequate nutrition.
However, in people who have the F508del mutation in CF, the F508del amino acid building block is missing. The puzzle pieces no longer fit together properly, and CFTR is unable to make it to the cell surface to function as a chloride channel. New drugs are being developed to help fix the CFTR protein in people who have the F508del mutation. These drugs are known as correctors. They bind to the CFTR protein and help the puzzle pieces fit together properly. The first corrector that has been developed and approved by the FDA is lumacaftor. Researchers have found that adding a second corrector drug can even further stabilize CFTR. Once stabilized, the CFTR protein is ready to be moved or trafficked up to the cell surface and function as a chloride channel. Now, the corrected CFTR protein is being formed, then moved through the cell and up to the cell surface, where it can now function as a chloride channel. Once the corrector-treated CFTR reaches the cell surface, another drug known as a potentiator can be used to bind to the protein and further open up the chloride channel. The first FDA-approved potentiator drug was ivacaftor. Through corrector and potentiator drugs, the CFTR channel is now able to better function and restore a healthy balance of liquid on the airway surface.
In conclusion, cystic fibrosis dance members conductor regular modular are a new class of drugs that act by improving production, intracellular processing, and or function of the defect protein. Thank you very much.